Let's leave it at that. Yes, sir. Good afternoon. Happy Friday to all of my fellow Mississippians, and thank you for joining us on what is a wet Friday afternoon. As we mentioned earlier in the week, our numbers are improving, and it is because of your efforts. As we know, our 7-day average peaked at 1,358 cases over a 7-day period on the daily number. Today, over the last 7 days, that number is less than 800. If you look at what occurred 3 weeks ago, we reached a level of approximately 9,100 cases. If you look 2 weeks ago, as I mentioned on Monday, we had gotten that number down to 6,700 cases over the 7-day period. It appears, based upon my back-of-the-envelope math, that we're going to, again, reduce that number over the 7-day period from Saturday to Friday down to about 5,500. So we did about a 30% decrease from 3 to 2 weeks ago. We did approximately a 20% decrease from last Friday to this Friday. So the numbers are going in the right direction. That is something we should be proud of. Certainly something that I am proud of, but I also know that that just gives me even more reason to work even harder over the next several weeks. Because if we can have 2 more weeks like we had the last 2 weeks, and we can cut these numbers in half again, then we will be in a much better position, and we'll be back near where we were in the March and April timeframe in terms of community spread. If we stop working now, if we pretend like we've done our job, then the numbers are going to go back up very, very, very quickly and very rapidly. We also know that hospitalizations are a lagging indicator, much like deaths and fatalities are a lagging indicator. If you look at our hospitalizations today, if you look at both confirmed COVID plus suspected COVID in our hospitals, that number is about 1,120. That number peaked a little over 1,250 3 weeks ago. So we're down a little over 10%, but we've got to keep working. We need to, again, cut that number in half, and we can over the next 4 to 5 weeks if we can remain very, very, very diligent. And so my commitment is to continue to look for ways to reduce community spread. And we know that one of the most important topics that we have to consider is education and the activities that surround education. I believe in my heart that we can work to educate our children while also keeping the community spread of COVID-19 to a minimum. I'd really want to commend everyone across this state who has been working hard to ensure that our children get a quality education in spite of this global pandemic. One of the open questions has been about sports and other extracurricular activities. First of all, we can be adults. We can admit that every activity in life carries risk. There is a reason that ambulances are parked outside of high school football games in a normal year. We also know that we can and we must manage those risks. I believe that sports and these other activities are instrumental in the lives of young Mississippians. They teach discipline and responsibility in a way that cannot be replicated in a classroom. For many, it's these extracurricular activities. It's football, it's soccer, it's band, it's other things that are the ticket to a college degree and a new life. For the rest, they provide a structure and an incentive to learn. I don't know how many more high school dropouts we would have in this country without sports. I do know that several of my buddies growing up only took their grades seriously because they took sports seriously. They cared an awful lot about what they had to do to maintain a GPA so they could stay eligible to play. Some in academics might say, well, that's foolish. And maybe it is. But I do know this, it happens. It happens in every single high school across Mississippi, and it happens in every single high school across America. Having said all of that, we also know that we are living through a pandemic, the likes of which this country has not seen since 1918. One of my greatest concerns heading into this school season has been sports and those other events which cause the community to come out in large crowds. Please hear me say this. 22 players on a field is not going to overwhelm a local hospital. 22 players on a field is not going to overly stress our healthcare system. However, 2,000 people in a small school's bleachers absolutely could have that effect. And because of that, and because I want high school sports and I want college sports to continue, I have already signed an executive order today. Now, it is dealing only with high school sports. We will continue to discuss college attendance in the days and weeks to come. But I have signed an executive order that extends our current rules in our EO for 2 more weeks until the last day of August, August 31. And in addition to that, I've signed an EO that places an attendance cap on extracurricular activities like sports. All K through 12 schools in Mississippi will be required to ensure that no more than 2 spectators per participant are attending. That may mean 2 parents. It may mean your dad and your sister. It may mean your mom and your brother. It may mean your best friend and your boyfriend. But only 2 spectators will be allowed for each athlete or for each band member, cheerleader, or other participant in whatever extracurricular event occurs. We are doing this until the end of August. We will evaluate how well schools are enforcing it, and we will evaluate if we are successful at continuing to drive our numbers down. I believe that this is a prudent step to help us ensure that we can keep kids in the classroom, which is our number 1 priority, while also giving all of those kids with extracurricular activities an opportunity to perform, to compete, and to learn valuable lessons in life. Now, I understand that this is not going to be popular with some. I totally understand that. But what I want all of my fellow Mississippians to think about is when we talk about high school sports, is it for the family or are they for the student athlete? If in a pandemic we can protect the student athlete and protect your families at the same time, then we will be accomplishing something. A goal that I believe is worth fighting for. I understand this is not fun, but it is necessary. As we work to continue to improve our numbers, I believe that we have to take these steps. To all of my fellow Mississippians, please continue to stay vigilant. Please wear a mask. Don't go to parties. Don't let your guard down. We can beat our common enemy. We can beat this virus, but we can only do it if we're working together. So with that, I'm going to turn it over to Dr. Dobbs and let him give us an update on the numbers.
Thank you, Governor. So today we're reporting 944 new cases of coronavirus with 32 additional deaths. We are continuing to see this maintained moderation in our daily case counts, so would again reiterate the importance of maintaining our efforts at social distancing, masking, and small groups. Regarding hospitalizations, we have had some stabilization in our number of occupied hospital beds. We did have a bit of an increase in daily hospitalizations today, but overall we've had stability. But still, we have 11 hospitals with 0 ICU beds currently available. Looking at our deaths, we sadly have seen deaths in some younger individuals in Mississippi this week. We're reporting the death of one teenager with no underlying medical conditions, and also a young pregnant woman in her early 20s. A reminder that although severe illness and death in young people is unlikely, it does occur, and we should all redouble our efforts to make sure that we prevent transmission. If we're looking at the schools, so far we have 38 counties with schools reporting cases of coronavirus. Within those different schools, and it's more than 38 schools, it's just that's the number of counties, we have 109 teachers who are confirmed cases and 69 students. If we look at those who are quarantined, we have 254 students and teachers and staff that are quarantined, and 489 students that are currently under quarantine. We are performing surveillance of daily cases, or actually weekly cases, through the Department of Health, and are mandating reporting from each school to the Department of Health so that we can monitor activity. This is applicable both to private and public schools. We have also assigned 9 outbreak teams throughout the state. Each county will have a specific outbreak team that's there to assist not only with responding to outbreaks, but also for answering questions, and we've been in regular communications with school leaders to make sure that they know that they can contact them for assistance. And in regarding the schools, we'd like to reiterate that face shields do not supersede the need for masks. Masks are still required. Shields are an added element of protection, but masks are still necessary. We have also at the Department of Health instituted our new surveillance software, and we're seeing improved efficiency, so hopefully we'll have better operations going forward even than we've seen thus far. And finally, would like to announce that next Thursday, Friday, and Saturday, the Department of Health and National Guard testing teams will be working with the Mississippi Band of Choctaw Indians to perform universal testing at the Silver Star Casino parking garage in Choctaw, Mississippi. We're encouraging everyone in the area, members of the Mississippi Band of Choctaw Indians, and also people living in the surrounding communities to please come in and get free testing. You don't need to have symptoms. You don't need to have been exposed. You don't need an appointment. Just show up and we'll test you. So please come in next week, Thursday, Friday, Saturday, at the parking garage of the Silver Star Casino. And Governor, that's all I have for today. Thank you.
Thank you, Dr. Dobbs. I just want to point out for the people of our state, again, I will preface this by telling you that these are total cases in 2-week period that are about a week behind, because that gives us the ability to have complete data. And so, full disclosure, and CJ does a great job with following the numbers. But with the data that we are looking at, I just want to mention, we have a statewide mask mandate. And what we're seeing, as I mentioned earlier, is improved numbers. We're seeing the numbers over the 7-day period go from 9,100 to 6,700 down to about 5,500. That's very good. And in most counties, we're seeing a total case differential since the last 2-week period that is negative. In other words, we're seeing far fewer cases in a lot of counties. We still have a statewide mask mandate, but I want to just point out to those of you who live in Bolivar and Forest and Jones and Lee, as well as Union and Panola counties, just FYI, we are seeing less community transmission. We're seeing much lower growth in those counties, but we are seeing positive increases in cases. And so again, I want you all to be extra diligent in Bolivar and Forest in Jones and Lee, Panola and Union counties. There are a couple other counties such as Lowndes and Warren County where the case numbers are coming down, but they're coming down at a relatively slow rate, so they're really stable and relatively flat. And so for us to really continue to drive numbers down big, where we get that R0 number down below 0.9, which is where we are sitting today, we need it down below 0.9 in every single county. Remember, R0 is actually for every one person that has the virus, how many they are spreading it to. When that number gets up above 1, it is particularly bad because we see growth in cases. When it gets to 1.19, which is where it was 3 or 4 weeks ago, the exponential spread can really catch up, and that's what gets you in big trouble. Likewise, if you can get it down below 0.9 or even preferably below 0.8, you can start seeing significantly fewer new cases very, very quickly because of the way in which the mathematics works. And so again, please continue to stay diligent statewide, continue to wear a mask statewide. But I did just want to briefly mention, as I did on my Facebook Live yesterday, those counties, just to be a little extra diligent and a little extra vigilant in those counties. With that, I'm going to turn it over to Director Michelle, who is back with us today after meeting with local elected officials throughout the state, and let him give us an update.
Thank you, Governor. Good afternoon, everyone. I did have good meetings earlier this week with members of your Board of Supervisors as well as your city and county administrators talking about the Mississippi COVID-19 Emergency Relief Fund. Good meetings, good dialogue. As of today, we've received approximately 644 applications. We just want to remind everyone that's listening that the Mississippi Emergency COVID-19 Relief Fund is for counties and municipalities only. This is not a program for individuals and certainly not a program for small businesses. So please, if you would, just be aware for that and be mindful of that. And my folks will continue to direct you as best they can to other resources as they become available. Also want to reiterate the deadline. These applications will remain open until October the 15th. So please continue to work in getting your project work statements in for both public assistance and the CARES Act 100% reimbursement track. As a reminder, resources are available at my website at www.msema.org, as well as our call center. That number is, again, 1-844-522-7367. Just quick tropical update. It appears that Tropical Storm Josephine will continue to make that right hook off into the Atlantic. So once again, that's good news for us, and we'll continue to watch it as it moves out along the East Coast. Governor, that concludes my update for today, sir.
Thank you, Greg. Thanks for all you're doing. And with that, I will open the floor to questions. Yes, sir.
Governor, when it comes to football games, you have high school football games, you have bands there, you got cheerleaders there. Do those students also include, will they be able to have their parents come to the games as well?
That's certainly going to be a decision made by each individual school as to whether or not they're going to allow for those individuals. But if they are a participant, then there can be up to 2 per participant. I think what you tend to have in high school football, for instance, and by the way, this applies not only to football. Everybody wants to think about football because we've missed football, and football season opens for most, certainly independent schools, next Friday night. There's a lot of kids that have been working throughout the summer, but this EO actually applies not only to football, it applies to volleyball. And if you're indoors, and I should have said this, if you're indoors, it does require mask. So for volleyball and for other indoor sports that may be occurring in the fall, or at least may be occurring in the next 2 weeks and 3 days. In addition to that, it also includes outdoor sports. So if you have a cross-country meet, or if you have, I don't know exactly when tennis is played, but if you had a tennis match, this would apply. Certainly soccer, girls soccer, I know is going on for some independent schools, as well as others. But this would be it would be 2 individuals per participant. We would require mask by all individuals that are working for the school in the stadium. We would require mask for everyone who is inside the stadium, unless they are, if they're moving about, unless they are seated and are more than 6 feet away from people that are not in their immediate family. That is the only time that a mask is not required in our order. However, it is recommended in our order that everyone wear a mask at all times. And if I were, we certainly would allow each individual school to be a little more strict even than what our order is. And if I were running an individual school, I would require mask on the sidelines as well, certainly. But I think what our order does is allows for athletic events to continue to significantly limit the crowd, and I think that's good. The other practical thing is, when you think about the size of various teams, for instance, so if you think about the size of the football teams, the larger schools are going to have more people on their sidelines. They're going to have more people on their football team. And so they're going to be able to have slightly more people in their stands, but the larger school that has more people as participants also most likely in 9 out of 10 cases also has significantly larger facilities. And so when you talk about individuals per, it's virtually impossible in my mind for an individual school leader to say, okay, 25%, how are we going to allocate that 25%? Is it going to be first come, first serve? Are you going to have people showing up and getting in line at 1 o'clock or 2 o'clock in the afternoon on Friday? And if they're standing in long lines and they're bunched up trying to get in the stadium, that really defeats the purpose, right? And so I think the way in which to limit those large crowds is by doing it by a number of people per participant. We hope soon that we'll be able to expand that number, but we certainly can make no promises to that. The only way we can expand the number of 2 per participant is if the numbers in the community spread continue to decline at a rate similar to what we've seen for the last 3 weeks. We need to take that number, which was up near 10,000 over a 7-day period. We need to drive it down to the 2,500 to 3,000 level, which would basically be another cut in half from where we are today. That's where our target needs to be. That's where we need to get to. Obviously, we'd love to get to 0, but I've been very transparent in my responses since day one. Our goal should not be to completely eradicate the virus, because that's not a realistic goal. Our goal has to be to reduce community spread so as to protect the integrity of our healthcare system, and hopefully, if we can continue to drive this down over the next 2 or 3 weeks, we'll be in a better spot with that. CJ?
Governor, we've seen some school districts that have been very proactive about reporting, particularly Corinth. Others have not, and historically, it's been my experience in covering this kind of thing that school districts aren't always forthcoming about certain types of information. Now we're in a public health crisis, and we're already seeing some districts not reporting information publicly, instead choosing to communicate that directly to parents, and in some cases, not even confirming it with us. Why not require them to do so? They're already required to notify the state's health department. I know you were asked this last week, but I feel like this question needs to be asked again.
Yeah, sure. In fact, Dr. Dobbs and Dr. Carey Wright and I had a great long meeting yesterday, in which I think we have put a number of things in motion that we'll be able to announce in the coming days, probably early next week, on a couple of things a couple of initiatives that we're putting in place that we believe will help in a lot of different ways, but certainly help protect our kids and our adults in our public schools. But with respect to reporting, it is my understanding, I'm going to let Dr. Dobbs answer this, but it is my recollection and my understanding that the individual schools have to report to the state health department, and the state health department is going to report publicly, just as they did with respect to nursing homes, for instance, all cases on a county-by-county basis. But the requirement is that every single school, independent schools and public schools, because of the public health nature of this, have to report to Dr. Dobbs and his team. And I don't remember if is it daily or weekly. I don't know if you want to talk about
Yes,
that.
sir. Yeah, so they're going to submit information to us on a weekly basis, and it's going to include information on the number of new cases the new cases by a student or teacher, number quarantined, and a cumulative number as well. And that'll be something that we'll maintain on our website by county. It'll include every school within that county, of course. And there's 1,200 schools that we'll be monitoring, so it'll be a pretty big number that we'll be keeping up with. But even if they have zero counts, they'll be reporting that as well, so we'll have that information in the mix.
I would just also point out that Dr. Dobbs and his team have set up epidemiology response teams specifically for our schools. They've set up 9 of them in the various regions of our state. They have reached out to every individual leader within individual schools. Dr. Dobbs has communicated regularly with the leadership of our school districts and our schools across the state. And if an individual school has a case, one of their first calls, obviously parents need to be notified, but also the individual school leaders, one of their first calls should be to that ERT that is set up at the state health department, because that's a team that can come in and assist our schools in handling the myriad of challenges that come from where we find ourselves.
So just as a point of clarification, you don't feel it's the state's job to mandate that these schools release this information to the public, but instead it would be, as normally reported to the Department of Health, which would then reduce that to a county by county level, so you wouldn't necessarily get certain districts, you wouldn't necessarily get certain schools, and you'd only get those numbers weekly.
Well, that's where we are right now, and I think what you're going to find is that the vast majority of individual schools and districts are going to report publicly that information, and those who do not, you're going to find out probably before I do, because as soon as 3 parents know about it, everybody in the community is going to know about it, and it's going to become public. And so it really, the practical side of things, and we've seen this, obviously Corinth was very forthcoming with information, but we just heard about Gulfport here in the last day or so, and so and there's many other schools where we know there are certainly data.
I think the only concern, and I'm not trying to belabor the point, Governor, but I think the only real concern isn't so much maybe transparency on the part of the state or the districts themselves, but we're in this time of misinformation, as we all know, and you might have 2 or 3 parents saying things that aren't true, and if the district isn't saying anything, then that could run rampant on social media.
I think that's a valid point, and we'll take a look at it. We'll look into that and try to figure out how we can improve information. The one thing that I believe in this entire process, I'm sure I can personally be criticized for lots and lots of things, but an attempt at transparency is not one of them. Having sat up here at this table at least 3 or 4 or 5 days a week for 7 months, it feels like, we were trying to provide as much information to the public, because we believe that if you tell people the truth, by and large, they'll make good decisions. And if people across Mississippi make good decisions, it's going to help us slow the spread of the virus, reduce our numbers, and protect both the lives and the livelihoods of our fellow Mississippians. Renee?
Dave Elliott with WLX has a question.
Yes, I have a question for Dr. Dobbs and Renee, if I may. I'd like to request a follow-up. Dr. Dobbs, you said 32 of the 82 counties, as far as schools go, reporting cases. We've had incidents down here with symptoms, positive tests, students sent home to quarantine. In the case of long-term care facilities, there was no doubt we had a classic outbreak by any standard. How would you define an outbreak in a school setting?
Right. So we have several different layers. Our current definition for an outbreak within a school is going to be 3 or more cases within any sort of predetermined group, like a classroom or a team. So if you have 3 or more cases within a 14-day period, that will be considered an outbreak. And then there will be certain mitigation measures for that specific group. And then we'll just have different decision processes based on how many micro outbreaks a school has. It's very challenging also because all of these cases that we're looking at right now, pretty much they didn't catch it at school, they brought it to school. And so those are sort of key factors that are very important. And right now, schools are just a reflection of what's going on in the community. And then if we do that sort of snapshot of the community and we say, 1 to 2 people out of every 100 is going to have coronavirus, the same thing is going to be true in the school system.
Okay, and then my follow-up to that, again, using long-term care facilities as sort of a model, the health department got very aggressive about testing residents and staff at LTCs, but we're talking about 1,100 schools, nearly 500,000 students. If there were large outbreaks, is your department prepared in terms of personnel and available testing to intervene, or are these districts kind of left up to their own when it comes to managing with whatever resources they may have?
It's a little bit different situation, obviously, in schools because these are, kids who have their own provider and all that, and physicians. We do recommend that everyone who is identified as a contact, and a contact is defined as someone who spent 15 minutes within 6 feet of the other person with coronavirus. We do recommend they get testing, and in certain circumstances, we will try to provide testing for those close contacts. We did do that same effort in Corinth early on, and as resources are available and as the need arises, we'll do our best to keep up with it. But sincerely, though, if it were every member of a school, right, that would be a lot more difficult. The volumes are just really not sustainable if we were going to test every person in a whole school system on a regular basis.
Hunter Dawkins with Gazebo Gazette has a question.
Hey, Governor. Thank you, Renee, too, as well. I have 2 questions. One for you, Governor, the other one for Dr. Dobbs. The first question for you, Governor, is how exactly would the media coverage on different athletic events happen? Would we need to contact the school beforehand or the MHSAA, or that being said? And then the second question for you, Dr. Dobbs, if the individual that's an athlete has contacted you with COVID before the event, what's the timeline that they would need to participate in this particular event? Thank you.
Thank you for the question, Hunter. And and obviously we will, if we haven't already, we'll be posting this executive order and sending it out to the media. But we limit attendance to 2 attendees per student participating in the event, but we exclude the coaches, the teachers, official medical personnel, and the media. So you are excluded from that number, and so because you have I would argue, a First Amendment right to cover these things, you would have the ability to attend. Now, I would always reach out to whatever school you're going to just to make them aware so that you don't have an issue on the front end, but you certainly have, according to the executive order, you don't have to fill one of those 2 per participant slots because you're exempted.
And I'm not sure I exactly understood the question, but just as a foundational statement, if someone has coronavirus, they have to stay out for 14 days. And if they're exposed to coronavirus as a contact, they need to stay out for 14 days and quarantine. If there's an outbreak within a team, and within a football team too, the whole team was going to have to quarantine. So it's going to be very disruptive. So very important for everyone to be careful out in their extracurricular activities, because like parties and socialization, because that's going to be where people pick it up. We don't want to have outbreaks anywhere, but it's going to be really disruptive when the whole team's out on quarantine. It's going to make it impossible to play.
Jackie with WHBQ has a question.
Hello, happy Friday. My first question is, will there be a punishment in place or fines if schools don't follow the 2 per participant rule and don't follow social distancing? And also, what type of outbreak would you need to see to consider stopping these sporting events from happening? And I have a follow-up.
Sure. Well, thank you. Happy Friday to you as well. I think we're probably all glad that it is Friday, although it seems like for the last 7 or 8 months, every day has seemed like a Monday to many of us. The reality is that we are going to depend upon our school personnel to enforce these executive orders. Oftentimes there are local law enforcement at individual sporting events. But what I would say to the people of this state is this. We have spent hours contemplating exactly what this would look like so that we can have an opportunity to play sports this fall, while at the same time prioritizing every kid's ability to get an education and to do so in the classroom where possible. And so here's the deal. If you think playing sports is important, and I do, but if you think it and you're a parent, if you believe it and you're a school district administrator or a teacher, then help us do this right. Help us make sure that this executive order is enforced, that it is done the right way, because as long as we continue to see numbers fall, then we're going to allow sports to continue, and we're going to look for ways to expand crowd size. But if the numbers don't fall, if the numbers turn around and tick back up, then we've got a whole other conversation that we got to have. And so, what is the incentive to do right? It's not me writing the words on a page and signing an order. Yeah, some people will participate in that because some of us are rule followers. But if you really want to play sports for the entirety of the fall, if you want to get through the entire season, work with us. Enforce this if you're a local school leader. Understand, if you are a parent, that this is just the way it is. And we're trying to do things to get through this. I was on a call yesterday with many of my fellow governors around the country, and I will tell you, right now, we are more the exception than the rule. We are trying to give our people an opportunity to experience life while challenging in a way that is somewhat normal. If you are, my recommendation is, if you are the grandparent and you're 60 or 65 or 70 years old, try to find a way to listen to the ball game on the radio, or find a way to watch it online, or look for other ways to do this, because we want to protect everyone in our state, and we think at this time this is the best way to do it.
Okay, and for my follow-up, in terms of college sports, I know you said discussions will be taking place, but do you have an idea of a ballpark number of fans that you would allow inside a stadium, like Ole Miss, Mississippi State, Southern Miss, and so on?
I don't have a ballpark number at this time. What I would tell you is, if we do nothing, if we assign no additional executive orders, then the current guidelines allow for 25% of outdoor venues as the amount. And so what you can expect is that the number will be in that ballpark, no pun intended, although probably a little bit less than that. But we've had multiple conversations. You got to understand that when you look at these larger collegiate stadiums particularly, they are very, very large, and so there can be a lot of opportunities to spread out. We've got end zone bowls and things such as that you do not have in high school stadiums, and so you've got totally different areas. So you've got, for instance, at Vaught Hemingway, you've got the Rebel Club. So we've got to look at what exactly does it look like at the Rebel Club. You also have suites at Southern Miss and State and Ole Miss and some of the other parks, and so it's not going to be just a one-size-fits-all, here's the number, let's roll with it. And so that's one of the reasons that we're taking some additional time to look at it from a collegiate standpoint. And at least from the perspective of the Southeastern Conference, so with State and Ole Miss, they've already said they're not going to kick off until September 26th. So at least with them, we also have a little bit more time.
Lacey with Greensburg American has a question.
Good afternoon, everybody. I wanted to ask some more questions about the high school extracurricular activities, and of course, in particular, football. So how do the spectators buy their tickets? How are they supposed to, will they have to do it over the phone and then get a ticket to attend so they're not, having contact with other people? And will students be allowed, or will that 2-person per participant include students? So like if parents decide to go, then siblings won't be able to?
So the answer to your second question is yes. The 2-person per participant includes 2 persons per participant. It may be that in some instances the parents don't go or the grandparents don't go, and therefore students go. But students are not exempted from the limitations on the crowd size. Because remember, I want everybody to think about it like this: it's all about safety and reducing risk. And if you allowed for 2 parents per participant, but put 1,000 kids into a football stadium, then you're not going to be able to limit or even mitigate, for that matter, the kind of risk that is associated with it. In terms of ticketing, just like they do every other Friday night, that's going to be a decision that is made by each individual school or each individual school district, however they choose to do it. But clearly, the easiest way in which to do this, I would think, and again, everybody can make up their own mind, but there's going to have to be a very proactive approach, because what we don't want is there to be an event, and whether it's football or theater, in which there are 50 participants and therefore 100 people attending, and all 100 people standing in line at the same time bundled up. That defeats the purpose of the maintaining social distancing. And so let's use a little common sense. Let's be smart. Let's recognize that this is for the month of August. And so it would not shock me if some schools said, well, this is more than we can monitor, and therefore we're going to delay for a week or 2. And that's certainly acceptable. But if they want to play football in August, they are going to do so with only 2 individuals in the stadium per participant.
Patrick McGee with Sun Herald has a question.
Yes, Governor. I know there's going to be football scrimmages held in public schools on the 28th, but the regular season doesn't start till the 4th. Do you think it will be likely that you extend this order into the regular season?
I would say that it is less likely today than it was 2 weeks ago, but it's still likely that this would be extended into the regular season. It is going, the order as it was signed goes until August the 31st, which happens to be a Monday, and that's, it worked out well this month that the last day of the month was on a Monday. But as you all know, we have, from the get-go, we have done many of these orders on 2-week periods, and so August 31 happens to be the end of 2 weeks as we extend the other stay safer order. So I can't tell you with certainty what we'll do 2 weeks from now. I'd say it's probably more likely than not that this would be extended, but it's certainly not guaranteed if the numbers continue to decline at a very rapid rate. And so what I would say to you is this. Patrick, is if people want this to be not as strict on September the 4th, the best way to do it is over the next 2 weeks, stay at home. If you go out, wear a mask, stay socially distanced. Let's continue to crush these numbers and reduce the community spread, which is going to minimize the risk, which allows us to open things up a little bit. But we're not going to open it up unless the numbers justify it and the data justifies it.
Dave with WLOX has another question.
Yes, Governor. You've extended your executive order 2 more weeks with social distancing and masks until August 31st. How does that also apply to bars not being able to serve alcohol after 11 p.m.? Because a lot of bar owners down here are up in arms, kind of a dovetail on that question, because casinos are allowed to serve drinks on the gaming floor to guests 24/7. So how does this executive order affect the bars closing at 11 p.m.?
It extends the order which closes the bars at 11 p.m. It also extends the statewide mask mandate for 2 weeks, and as I will tell you, it's the order with respect to bars, because you're only allowed to serve individuals in bars even up until 11 p.m. with the ability to with individuals who have the ability to actually sit down in the bars. And that is not something that I wanted to do, because I don't want to limit any private sector business ability to make a living. But we know for basically a fact that there's been widespread transmission over time, particularly in the summer, with particularly younger people in bars. And so one of the reasons I believe that our numbers are going to continue to go down over the next several weeks is because of our limitations on bars. And I will tell you, while I know that there's a lot of very good, very frustrated owners of bars out there, when I think about Texas and Florida and quite frankly, a lot of places in the Northeast that bars have been closed for 6 months nonstop, we're trying to allow for an opportunity for them to at least generate some revenue and stay open. And I hope to be able to get them back fully open at their discretion as soon as it is safe to do so.
Lacey with Hattiesburg American has another question.
Okay, this one is going back to the schools with the number of cases. First of all, and I know like in Forest County, the 7th through 12th graders have put off for a couple weeks of going back to school. Would your extended order also include that as well, or will they be starting to go back to school in person?
That'll be a decision that.
I have another question.
Sure. That'll be a decision that is made by the local school board and the superintendent. But I have not extended the start date beyond that start date on Monday. So they have the ability to start back should they choose to do so.
Okay, and then the other part I want to ask about is, can you give us a ballpark of when we're going to have the list of counties that do have with schools with positive cases? Because right, 38 counties, that's nearly half the state, and I think that's something that people are really wanting to know about.
Yeah, and we have it, and we're trying to just organize it, just to be quite honest, but it's Adams, Alcorn, Bolivar, Calhoun, Chickasaw, Choctaw, Coahoma, Copiah, Forest, George, Hancock, Harrison, Jackson, Jones, Lafayette, Lauderdale, Lawrence, Lee, LaFleur, Lowndes, Marion, Montgomery, Neshoba, Panola, Pearl, Pike, Pontotoc, Quitman, Rankin, Scott, Smith, Sunflower, Tallahatchie, Union, Washington, Webster, Wilkinson, Winston, and Yalobusha. But we'll get it out there. I'm sorry for our translators over there. I know I'm killing them.
Well, and what I will tell you is, at this point, with school reopening, some as many as 3 weeks ago, many last week, many this week, many more next week, I think one of the important points for Mississippians to understand and to recognize and to be aware of is the vast majority of these cases are kids and or adults that got the virus not while at school, but in the community. And so while there are risks for transmission within our schools that we're going to have to deal with in the days and weeks ahead, there is also risk to our kids and our adults if they're not in school. There are cases that are being had by younger people that are being transmitted in the community. Most of these that we have were not transmitted within the walls of the school. They were transmitted within the confines of their community. And so there are risks no matter what we do. Our job is to do everything we can to protect our healthcare system, to make sure that every single person that can get better with quality care gets that quality care, and that we mitigate risk as much as is humanly possible.
Governor, I have another question.
Sure.
I wanted to ask you, you know what, I think you're off the hook. This is for Dr. Dobbs, I'm sorry. Dr. Dobbs, I wanted to ask you about, we've heard actually some allegations from parents saying that certain districts are not reporting these outbreaks. Like they'll call parents, but they're not doing it publicly, and they say it's because of HIPAA concerns. But I know that you're well versed in that. Can you kind of give us some clarification? There may be some administrators out there that need to hear why that would not violate the statute.
Well, first off, they're not reporting any specific patient data. That's the number one thing. But there are public health authorities that make it plausible where it has to happen. And we have also issued a public health order today mandating school reporting for private and public schools, just to make sure they have that sort of clearance and cover to understand that they really do need to do it.
I have a follow-up as well. Just with regard to the information that you plan to post on the health department's website, that county by county breakdown, when could we expect to see that? Can you kind of give us an idea? I know it's a lot of information.
I would think Monday, because we're still in process, and the reporting deadline is going to be on Monday every week. So I would anticipate that we'd have all of that sort of combined by then, because even this, what we're going to have, it's going to be 82 counties reporting cases, because 82 counties have active community transmission. And so it does reflect people walking through the doors, like the governor said, not necessarily anybody catching it there, but hopefully first part of next week.
But one of the key points here is we know that there's going to be cases ultimately in our schools in all 82 counties. That is why it is critically important that every school leader has their reopening plan and that they stick to it, and that reopening plan is such that it's been innovative. They've thought long and hard about it, because if, for instance, you have a reopening plan in which kids are coming in the classroom, but no kid is sitting in a classroom and is within less than 6 feet of one another, and every kid is wearing a mask, then the number of kids that are going to have to get quarantined is going to be relatively small. I've heard some examples, for instance, and having read the reopening plans, in a lot of elementary schools, one teacher teaches all day long and there's not a lot of movement, which is obviously better than kids out in the hallway moving around. And so I've heard and read some plans that, for instance, take individual kids and have the teachers move from classroom to teach different subjects rather than the kids moving in the hallway. And obviously that minimizes the amount of movement, that minimizes the number of people who are within 6 feet of other people, again, for more than 15 minutes. And so it really allows for a much easier response when the inevitable occurs, and it is inevitable that there is a case in all 82 counties. At some point, it may be Monday, it may be Monday week, it may be September 15th, but there is going to come a time when there are cases in all 82 counties, just like there are currently cases in all 82 counties in the communities. Seeing no other questions, we just shy of an hour here on a Friday afternoon, so I guess it's a light day. I know we've gone an hour and a half earlier in the week, but we continue to work. We continue to find ways to mitigate risk. We continue to look for ways to make it even better and drive down these numbers. What we are doing is working. What you are doing is working. Now is not the time to rest. Now is not the time to ignore it. Now is the time to step on it. And I'm convinced that you all will do your part to do that. And so I look forward to seeing you soon. Stay safe out there, and God bless.